Hey, what's up, everybody? It's Dr. Jason Jones back with another episode of Health Made Easy. And this episode really is going to be part information and really part encouragement for you out there. And I title it Finding Relief Without Drugs because oftentimes the message that we give it can be misconstrued as an anti-drug message or an medical care message, and that couldn't be farther from the truth. We just have a really pro natural health message. We're just very pro natural health care. Not that those other things aren't warranted or needed at some point along the way. Personally, hope I don't need those things, but really just want to encourage you today because finding pain relief oftentimes can be an ongoing hassle, from pills that have several different side effects to other ointments that, might smell bad. It could be challenging to stay motivated and keep searching for better, pain relief options. But at our office, we provide everything from, chiropractic care, which is very non-invasive. It's certainly an alternative. Literally no side effects. We have what I call side benefits, which are patients getting a lot of things that they didn't come in for, like better sleep, they have more energy. They have problems that they didn't come in for start to clear up. They have whole systems, like their digestive system, work better. Had a pregnant mom tell me that yesterday, that their whole digestive system was working better since beginning to work with us, and that was really the only thing that they changed. So, pain, it can be regarded as a natural warning sign that's within your body, which we certainly hold true to that belief. And I'll give you an example. Imagine like a smoke alarm. None of us would live in a place that didn't have a smoke alarm. And when the smoke alarm goes off, that is nothing more than a signal that there's something more dangerous that's actually happening, like a fire. And none of us would get up in the middle of the night and rip that thing off the wall and stomp on it until it stopped, and then just go back to bed. But oftentimes that's what we do with pain. We cover it up, we numb it up, and if that doesn't work, we keep trying to do that just to get the symptoms to go away. But the symptoms are an indicator that there's a much bigger problem going on that's there. So the nerve signals for pain only comprise about 3 to 4% of nerve function. Period. Anyway, but they do inform you that a problem requires your attention, and it could be a traumatic injury. It could be a joint problem, a disc problem, a muscle problem, a tendon problem, a ligament problem. But it is an indicator that something is going on with you. And this is certainly true of acute pain because you might have stiffness. There could be sensations of pain that discourage you from utilizing, the injured body part while it's trying to heal, which is probably not a bad idea. But sometimes it's better off to use it. And as soon as the condition is resolved, then the pain disappears. However, most of the time, pain could outlive its importance, as we say, lasting for months or even years after the body has done its best to tackle the underlying problem, and it needs some extra help. So, in a study carried out in 2019 by New York University, graduating students on American citizens, they found that chronic pain was found to affect about 116 million of the Americans. And that's a huge number, especially considering I think we're only 350 million people in America. The pain that plagues you might be consistent. It might come and go. It might linger for a number of weeks, but it might go a whole heck of a lot longer than that. And certainly medications have problems. Pain medications can often certainly give you relief, but they do come with a whole host of side effects, even over the counters. And you might have things like drowsiness, dizziness, confusion, headaches. You can certainly, like we talked about with opioids, you can have addiction and overdose with certain pain medications, or that's in the most severe sense. But the body also becomes used to drugs as time goes on. So it's more pills, more powders, more potions, more lotions for the same results you're looking for. And long-term utilization of pain medications, I don't think that's recommended by anybody, even though people will do it for years and years and years. But we have found, and we do know, like we talked about in previous podcasts, about 16,000 people die every single year from taking NSAIDs or over-the-counter painkillers, and they die because they bleed internally from taking so many of those medications. There's even problems with creams and ointments, from ointments that claim to decrease joint pain to creams that assure you're definitely going to have pain relief. Several products essentially just don't work. Most creams and ointments are what are called an astringent, which means that they irritate the skin, which is a lot like rubbing your elbow after you whack it on something. It's like kind of blocks the pain that's there. And certainly they can be sticky and they can certainly smell for sure. And they can stain your clothes, they can destroy your upholstery. It's just one of those things where it's just temporary relief at best. And I don't fault you for that, for trying to have temporary relief, because when you're hurting, that's what you want. You want to feel better for sure. And we talk a lot about chiropractic on here because we are, or I am a chiropractor, but I'm also, my undergraduate degree was in athletic training. So we did a tremendous amount of rehab on very high caliber athletes. So everything from the bottom of the feet to the top of the head, we've seen it and worked on it. And certainly we're not an expert at every single thing, but I have seen a lot over the last 20 plus years being in healthcare. And if you are suffering and you do have questions, and a lot of you guys who listen to this podcast are not local, and that's okay. I'm happy to help you. I would say go to our Facebook page. You can message us through there. If you are local, you're looking for non-invasive, natural methods to not only feel better, but to have more mobility, more flexibility, move better, function better, have a better quality of life. That's what we provide, for people, and we're happy to do it for you if we can. But the really only way to know that, and the only way to know that any doctor or any therapist or anybody can help you, is they do need to evaluate you. They do need to perform a very proper exam for you, and that's the most important thing. Get the exam first, because just imagine if you went to a doctor and they said, "Hey, I think you have high cholesterol and I want you to take these cholesterol pills," you would say, "No way." But if the doctor did blood work and proved to you that your cholesterol was high, you might at that point want to take their advice, or you might want to do something natural to bring it down on your own. At least you have the data to know where the problem is and it was accurately found. So enough of my soapbox on that. You guys hang in there. Be strong, be well, move well, eat well, think well out there, and be well. And we'll see you guys on the next podcast. See you later. Bye-bye.